morning.
My name is Shedrion Elom, and I'll be your social worker today. Um, what issue are you here for today? What is something that
Um,
you came here today for?
I've been having a serious problem with drugs and alcohol. Me and my wife are separated, uh, and I just find it hard to deal with. So I just keep drinking, trying to drink it away, and every morning I wake up, it's still there. So I just really need some kind of help,
Mm-hmm.
maybe some kind of program I need to go in. I don't know. It's really getting bad. I'm to the point where I just don't even feel like my life is even worth living.
Okay. Well, I have a couple of questions before we actually approach your assessment. You were saying that you and your wife are actually having issues. Your relationship is kind of maybe going into turmoil. What things have y'all actually experienced? Like, has there been any signs of like, abuse or neglect or anything?
No, it's not abuse or neglect. I just get angry because she won't listen to me.
Mm-hmm.
It's just like I have no authority.
Mm-hmm.
She listens to her mother. Whatever her mother tell her to do, and so it makes me real angry. When I try to discipline the kids, I try to tell my son something, she tell him something different,
Mm-hmm.
and it just bothers me. Till I get so angry, we'll argue about it,
Mm-hmm.
and it's like she don't care what I have to say about it, and so I just go out and get drunk.
So, do you think that actually, well, you just said that you go out and get drunk. So, do you think that she may be the cause of you being addicted to alcohol and drugs?
No, to be honest with you, I've been drinking all my life.
Okay.
Ever since this has been a routine in my life.
Mm-hmm.
Ever since I was 13, I would drink for courage to say what I want to say. And before I didn't realize I was becoming an alcoholic even at a very young age. So I would drink. And then eventually, I started using marijuana.
Mm-hmm.
And it just got to the point where I had to
Mm-hmm.
have it. I couldn't live without it. I find myself drinking all day long, in the mornings, noon and at night, and till I have blackouts and do stuff, don't remember
Mm-hmm.
what I've done, and my wife constantly tell me, "Oh, you don't remember you said all that to me last night?"
Mm-hmm.
And so I'm just tired of living like that. I need help to figure out how I can just, you know, become clean and sober,
Mm-hmm.
because I know it's a better life out there than, and I know I'm damaging my body.
Mm-hmm.
You know, I've heard things, I've seen television commercials, how alcohol and drugs just destroy a person, you know. And I've gotten to that point where I want to quit,
Mm-hmm.
but I can't. So maybe I'm hoping that there's somebody that can point me into the right direction or give me the help that I'm looking for. I don't know what it takes, but I'm willing to do whatever it is I need to do.
Okay. Well, that person is me today. So you were saying that you have actually been drinking since you were 13,
Yeah.
correct? Okay. So are you the first generation that has actually abused drugs and alcohol, or have previous generations before you, have they abused them?
Well, I'm the oldest in my family, but even now, my brother, he drinks, he might drink even more than I drink.
Mm-hmm.
My father used to drink. Uh, you know, I've heard stories of my father drinking, but I don't know whether he was an alcoholic or not, because he still was able to perform his fatherly duties
Mm-hmm.
by going to work every day. And that has been a problem for me, because I wake up drunk, I call in, you know, but my father never did that. But he was a drinker. My mother didn't drink. She would take a drink every now and then.
Mm-hmm.
And but on my mother's side, my uncle drank, and he the one pretty much started me to drinking.
Mm-hmm.
And he would take me to parties with him, and you know I started drinking, and I like the feeling I got. So you know it made me more sociable. I thought it was making me more sociable. I was able to, you know, I got confidence from the bottle.
Mm-hmm.
And so, you know, me and my friends, we would go to games, and naturally we would drink. We would drink before we get there, drink while we there. So it has become a problem. You know, even with my job, it's interfering with my employment, it's interfering with my family life, it's interfering with my marriage. And I just want to, you know, get rid of it, you know, before I do permanent damage. Hopefully I haven't already done that.
Okay, well, drug and alcohol addictions, as you know, you've actually witnessed, are very, you know, they can affect yourself as well as your outer circles, such as your family, your, you know, employer, and other avenues. You know, they can also alter your thoughts. They can alter your behaviors, your moods, your physical appearance. They basically, what I'm trying to say here is, you know, they can do, as you say, permanent damage, permanent damage, temporary damage. You know, basically, you know, just tearing down those walls that you had built up for years and years. Well, since it's an addiction, it's more of a dependency on the drug, and you'll probably do whatever it takes to get that. And so it could cause, you know, you to actually have consequences such as failed relationships, homelessness, unemployment, like extended periods of it, possibly go in and out of jail, domestic violence or abuse, depression, and other legal issues. So those are things that could actually occur. But today we're here to help you actually overcome those obstacles, build those relationships back, and help you out with some extra job skills so you won't have issues with future employers. All right, so now we're going to move along to the assessment here that we have to complete. All right. Okay. And what is your name again, sir? I'm sorry.
Melvin Edwards, senior.
Okay. Melvin Edwards, senior. Okay. And what is your date of birth?
September the 27th, 1954.
Okay. And your primary language?
English.
Okay. And do you require special accommodations such as an interpreter or assistance with any written materials?
No, I don't.
No? And what is your current address?
1911 Hawthorne Street.
And the city?
Savannah, Georgia, 31404.
Okay. And your phone number?
912 346 2409.
Okay, and you tell me what brought you here today. You said issues with drugs and alcohol. Okay. And also issues with your relationship with your wife.
Yeah, she asked me to leave, so I'm about to be homeless.
Okay.
Just throw that out there. That's normally what happens. Real.
Okay. Have you had other Rule 25 assessments prior to this?
I have been in different programs trying to get sober before,
Mm-hmm.
and only to find myself going back to the drugs and alcohol.
Okay, so you feel like those programs weren't sufficient enough? They didn't help you out enough?
Well, I don't know. I wouldn't say that. I guess I just didn't do what they told me to do.
Mm-hmm.
And so most of the programs teach the same thing.
Mm-hmm.
You know, just take it one day at a time. But I get to the point where those cravings hit me, and then I just have to have a drink. And so I think I was undermining my own self. Just probably was in denial, not believing that I was alcohol or addict. Just believe that I could actually use and get a different outcome, but it doesn't work.
Okay.
The outcome is always the same, negative.
Okay. All right. So, what other places have actually, what other programs have you actually went through?
Well, I went to Thailand's 28-day program. I went to this church program called the Resurrection House. I went to this program called SAM, Substance Abuse Ministry, which was also another program in the church. I went to Winterway Hospital in Statesboro, which was another 28-day program, which was very, very nice facility. And I've been in Salvation Army program, which is a 90-day program.
All right. Let's go to the next page here. All right. Next we'll be discussing your acute intoxication or withdrawal potential. So, basically, in front of me here, I have a list of different types of drugs. Most of them are drugs that are commonly used throughout people who abuse drugs or people who just use drugs in general. Okay. The first drug is alcohol. What was your age of first use?
13.
Okay. And it asks for your most recent pattern of use and duration. So it's asking me for the frequency.
Every day.
Okay. Every day. And how?
24 hours a day.
Okay.
Whatever chance I get to get a drink.
Mm-hmm.
I even take it to my job and store it in my locker. I used to do it for real. So everything I'm telling you is what I used to do.
Mm-hmm. Okay. Date of last use and time.
Okay, that's a good question because I don't know how to answer that right now because
You can just make something.
right, last night.
Okay. Okay. Now, your withdrawal potential, the periods of withdrawal, have you felt like if you don't have that in your system, like can you hold out longer than a day or a minute or?
It's real hard. When I wake up in the mornings, I think about being separated from my family, not be able to be with my son or my daughters, and so I'm ready for a drink right then. I'll be going through withdrawals. As soon as I get sober, I'd be real irritable and stuff like that, angry.
Okay. And your method of use for alcohol? well, I don't know why.
Yeah.
Okay, maybe that's for other ones. Okay. He also said marijuana or hashish.
Yeah, I started using marijuana when I was about maybe 19.
19. Okay.
I remember my cousin, smoked one with me. And I remember getting really, really high. So I was scared. I run around the park. I thought I could run it off. And my father was talking to me and I just started laughing like I was crazy.
Okay.
And I've been using marijuana every day too.
Every day.
And in my middle 30s, in my later 30s, maybe when I was about 30, is when I was introduced to cocaine. And that's when my life really became unmanageable.
Okay.
That's when all my money was just going. Cocaine took me off of marijuana, and it became my drug of choice. And I started out using this on the weekends, but then it wasn't long before I started using it every day.
Okay. And how did you actually? What was your method of use for cocaine?
I was snorted,
Okay.
and eventually I went to smoking it, crack cocaine, and that's when I really went down to the point I became homeless, separated from my family. And that's why I'm here today, because I need help. Crack cocaine is so addictive, and it leaves you really depressed after you use it. And then you can't get enough of it. It's the worst drug I ever encountered in my life. You have to have it, It's just, you'll spend every dime you get. I spend every nickel I get trying to get this euphoria high that I had from the first hit, but it never happens.
Okay, so you said that this drug, it caused you to be homeless or on the way to homelessness?
It caused me to be homeless because I got no money to pay my bills. My wife wasn't putting up with that, so she just said that it was time. She thought it was best that I leave.
Okay.
So I'm sleeping in old, empty houses, old abandoned cars.
So would you feel as though that cocaine may have ruined your life or severed a lot of relationships?
It has.
Alright. Meth? Have you used
I
meth?
never used meth.
Okay. Heroin?
No, I never used heroin.
Any other opiates or synthetics? No. Inhalants?
I tried acid once.
I think that's hallucinogenic.
Yeah.
Okay.
Tried it one time
Okay.
because I was pretty much scared of that stuff. Somebody actually put it in my food
Oh, okay.
because I wouldn't voluntarily take it.
Okay.
And of course, you could lick acid or
Yeah.
take it orally. So, but pretty much it's cocaine, crack cocaine, and marijuana and alcohols.
Okay. Alright. Do you use greater amounts of alcohol or other drugs to feel intoxicated or achieve the desired effect, or use the same amount and get less of an effect?
It's gotten to the point now. I'm drinking pretty heavy, and I have built up a tolerance for alcohol, it seems it takes more now to, and I started like drinking half a pint every other day, but now I can drink a pint to a half a gallon.
Okay. And like the more and more you drink, or the more and more you drink, does it still give you that effective, like, not necessarily euphoria because it's
Right.
alcohol, but like
It does the same thing to me. I drink till I pass out.
Okay.
You know. I almost killed myself one time. I drove my car into a tree, and I just.
Okay. Have you ever been to a detox, or have you ever undergone a detoxification?
Yeah, I guess at Willing Way, they got the shot, what they call. That was one of the first things they do to you, called a silver bullet, and they shoot you in your hip, and you don't wake up for 24 hours. And so, all these programs have the, but I would say Willing Way was the only one.
Okay. And that was the one that was in Statesboro?
Yeah.
Okay. All right. And do you know around what age you got that detox shot?
Probably I might have been like 39. I was working for Inner Marine, and they sent me to They sent me to Willing Way. My job paid for me to. I went to them and told them I had a problem with drugs and alcohol, so they sent me to this program.
Okay. And have you ever had any other detoxifications since then?
No.
No? Okay. All right. So now we're going to discuss your withdrawal symptoms. I'm just going to ask you some symptoms. Have you had any sweating or rapid pulses?
Rapid pulse. Yeah, probably both of them.
Any shaky or jittery tremors?
No, I haven't gotten the DTs yet.
Okay. Have you been unable to sleep at night?
Sometimes.
Okay. Any agitation?
Yeah.
Headaches?
Yeah. Migraines.
Okay. Have you ever been fatigued or extremely tired? Okay, you did say you've actually experienced some sad or depressing feelings.
Yeah, depressing.
Have you ever had any muscle aches or muscle spasms?
Yeah.
Any vivid or unpleasant dreams?
Yeah.
Irritability?
Yeah. Very irritable.
Sensitivity to noise?
No.
No. Any times that you've been to the doctor, maybe a clinic, and they've actually said you had high blood pressure?
No, not really.
Okay. Have you had any nausea or vomiting?
Yeah. Plenty of that. Just about every morning.
Dizziness.
Sometimes.
Seizures.
Seizures.
Diarrhea.
Yeah.
Diminished appetite.
Yeah.
Hallucinations. No. Fever.
Sometimes I get a fever.
Inability to eat.
Yeah.
Psychosis. Are you familiar with what that is?
It's like I want to commit suicide or something like that.
Not necessarily. Like psychosis is more like, have you ever felt like you were going like crazy or psychotic?
No, I wouldn't think I was crazy. It's just
Okay. Confused or disrupted speech.
no.
Okay. And anxiety or worry.
Yeah. Plenty of that. My mom used to tell me that was my worst problem. I worry too much.
Okay. Alright. So, let's do this. Okay.
You know, did 40 minutes. You know.
It's been 40 minutes.
Yeah.
Oh wow. That means this is gonna. We have to speed through this, but at least we're gonna get these answers first.
No, I mean,
Oh, on there. It's,
no, I'm just saying. I wouldn't worry about it if it goes over.
Yeah. Right now it's at 27.
Well, that what yours say?
Mhm.
I must have tabbed it wrong then. I thought we started at 12:25.
Yeah, I just put it on there.
Well, let's do for time.
Yeah. Let's see. Okay. So it's asking me like to do this. Okay. Okay, I guess it's not move past that. Do you have any current health or medical concerns? I'll ask you. If you want to answer it again, you can.
You already asked me?
Yeah, I asked you that before I even did the assessment.
Oh, okay. Well, yeah, I have a lot of stomach problems.
Stomach problems such as.
Stomach hurt from drinking. Not eating,
Okay.
I guess. I had to go to the doctor like twice for that. And it said I had,
Cirrhosis.
no, not cirrhosis. Man, I forgot the word for it. Not diarrhea, but the other word, I can't think of it.
Constipation.
Not constipation. It's something that causes your stomach to ache. And it comes from drinking. I can't think of the word right now. I forgot what it was. I went to an internal intestine doctor.
Was it? I think I know what you're talking about.
Yeah, I can.
I mean, is it on the.
Gastritis.
Okay.
And it comes really from drinking and gives yourself gas and that. Bad problem with that. Other than that, I'm pretty healthy.
Okay. Do you have a health care provider?
Yes, I do.
Okay. And when was your most recent appointment?
I'll say about 3 months ago.
And what concerns were identified during this visit?
That's when I went to check on my stomach,
Okay.
and they told me it was gastritis.
And how do you deal with these concerns?
You mean the troubles I've been having?
Yes, with your stomach issues, gastritis.
I just take another drink.
And do you feel as though that's going to take away the pain?
It always take away the pain at that moment.
Okay. Do you feel like that's working for you?
At the moment.
Okay, you said you were receiving care. What are some medications, including over-the-counter or herbal supplements, do you use to, help out with the pain management besides?
I just sometimes take a laxative. When I find myself not drinking, I just, pretty much that's all I really do. Whatever the doctor prescribed for me to take.
Do you follow current medical recommendations or take medications as prescribed?
Yes.
Okay. When did you last take your medication?
This morning.
Has a healthcare provider or healer ever recommended that you reduce or quit alcohol or drug use?
Oh, yes.
Okay, and you know that you aren't pregnant. Okay. No. Have you ever had any injuries, assaults, or violence towards you, accidents, health-related issues, overdoses, or hospitalizations related to your use of alcohol or other drugs?
Yeah.
Alright, can you explain those to me, or at least
Well,
one?
one time I told you about I drove my car into the tree. I like to gamble, and then I got into a knife fight because I was drinking and probably was talking too much trash. So the guy decided he wanted to cut me. I've gotten a couple of DUIs, which have caused me financial problems by paying fines and even incarceration.
Okay. Do you have any specific physical needs or accommodations?
Well, like I said, I'm gonna need a place to stay. I think that's about it.
Okay. Alright, we're to dimension 3. Okay. Okay, you already told me that because I already asked that question. The question basically is, tell me what it was like growing up in your family.
Rough. Me and my brother and I fought every night. he was, I don't understand. But other than that, we had, you know, good family life. Me and my brother just couldn't get along. He just like, I don't know, he was crazy, man.
Mhm.
And to come to find out in the past, I just found out he was crazy for real.
Okay.
He was schizophrenic, and we just found out. And so, other than that, I love my childhood life. You know, I just love to play basketball, go to school. I did really good at school.
Okay.
Could have been an A student if I was did what I was supposed to. I love my mother and my father.
Okay. And I have one other question besides that. When you were talking about your father earlier, you said him and I think you said your uncle,
Yeah.
on your mother's side, they both drink. They drink together at times.
No.
No. Okay.
My father was way older than my uncle.
Okay.
As a matter of fact, my uncle is just like 1 year older than me.
Mhm.
And he's my mama's brother on my mama's side. I never knew none of my daddy family. But my father what really made him quit drinking is he almost burned the house up, so he didn't drink after that.
Okay. So, have you ever witnessed any violent behavior between your parents while you were growing up because of his drinking? Because I know you said that he presented himself as the perfect father figure.
Yeah, he didn't ever really beat my mother or anything. I mean, he slapped up one time.
Mhm.
You know, that's the only thing I remember.
Mhm.
It was just one quick hit, and she
Mhm.
straightened up real quick.
Okay.
So it was never really no serious violence.
Okay. Okay. When was the last time that you had significant problems with feeling very trapped, lonely, sad, blue, depressed, or hopeless about the future?
This morning, sometimes I just feel like nothing I do pleases my wife, and you know, I feel like I'm a failure as a father sometimes.
Mhm.
Not a good provider. I want so much from my children that I didn't have. Education, want to give them homes and whatever. I just let that worry me too much sometimes, I guess.
Okay. When was the last time that you had significant problems with sleep trouble, such as bad dreams, sleeping restlessly, or falling asleep during the day?
Oh, yesterday.
When's the last time you had significant problems with feeling very anxious, nervous, tense, scared, panic, or like something bad was going to happen?
Yesterday.
With becoming very distressed and upset when something reminded you of the past?
I pretty much, yeah, when I think about my past, I do get upset. I feel like I could have been better off.
Mm-hmm.
So I would say I was thought about that yesterday too.
Yesterday? Okay. When thinking about ending your life or committing suicide?
I think about it, but I know I'll never do it.
Mm-hmm.
But I think about it a lot.
Okay.
But I know I haven't even said it, man. Wish I was dead.
Mm-hmm.
But I know I'm not brave enough to put a gun in my head.
Okay. When was the last time that you did the following things 2 or more times? Lied or conned to get things you wanted or to avoid?
This morning.
Okay. hard time paying attention at school, work, or home?
Today.
Had a hard time listening to instructions at school, work, or home?
Today.
Were a bully or threatened other people?
No, I don't bully anyone. Threaten anyone.
Started physical fights with other people?
I don't do that.
Okay. For question number 2E, which was with thinking about ending your life or committing suicide, what was the frequency and history of suicide in your family or someone close, and were they underneath the influence?
They said my father committed suicide, but he wasn't under the influence. He just went missing. I think he was just more depressed because my mother was sick and she died. Well, he just left that she could get, in order to receive his Social Security, I think is why he left. And then after 8 years, they found his bones in the back of the woods. But I don't think my father killed himself. I think somebody robbed him and killed him. But that's what the report said, that he committed suicide because he was despondent.
Okay. Have you ever been diagnosed with a mental health problem? Are you receiving care for any mental health issues? Okay, you're not.
No.
Have you been prescribed medications for emotional or physical or psychological problems?
No.
Have you ever been verbally, emotionally, physically, or sexually abused?
Yes.
Okay. Which one out of those 4?
Verbally and emotionally.
Is it by peers or close relatives or?
Yeah, my uncle, my wife, brother, friends.
Have you ever received counseling for abuse?
No.
Do those issues still bother you today?
Not much. I've learned to let them go. I used to hold on to them, but I'm getting better with letting them go.
Have you ever experienced or been a part of a group that experienced community violence, historical trauma, rape, or assault?
Community violence. Only violence I've been around is like when we go to school, you know, we used to have gang fights, you know. And me, some of my friends, we would go to clubs. I've seen people get shot, but just randomly, no, I would say no.
And how has that affected you? That you've been in that, not necessarily been a part of it, but actually have.
I just don't, I don't like it. You know, sometimes it make you afraid that somebody's following you. Like my brother got shot, you know, and the guy who shot my brother was following me one day, you know. And I ain't thought nothing of it because, like I told you about my brother, he was crazy. So, but it might make you a little fearful for your life.
You said you have not received counseling. Are you a veteran?
No.
Have you had any exposure to combat?
Mm-mm.
Do you have any problems with the following things in your daily life? Headaches?
Yes.
In relationship with others?
Yes.
Dizziness?
No.
Problem solving?
Sometimes, according to how
Reading, writing, and calculating?
no.
Concentrating?
Sometimes.
Performing your job or schoolwork?
Yep.
Fights, being fired, or arrests?
Fired and arrest I have had.
And remembering?
Yeah.
So how do you deal with headaches and fights and arrests and those other issues on a day-to-day basis?
Well, the headaches, I just grab a couple of aspirins and a Coke maybe, or Goody. Or I would take some, stuff I used to do. I can't think of it. But pretty much that's for the headaches. As far as the rest go, I just, you know, go to court and do what they tell me to do. Pay my fines if it's a fine. What was up?
In relationship with others, problem solving, concentrating, performing at your job or school, remembering.
It's just pretty hard, you know. I have to quit. I'm fine when I ain't drinking. It's just when I'm drinking, I can concentrate and do everything. Even my boss told me, "Man, you fine when you ain't drinking, man. But it's just when you drinking, you let the lines plug up."
So you said when you're drinking, you feel like you can do. Okay. Have you ever been diagnosed with traumatic brain injury or Alzheimer's? Have you ever hit your head or been hit in the head?
Yeah. Got hit with a bat one time.
Were you seen in the emergency room, hospital, or by a doctor because of an injury to your head?
Yeah, when I ran my car through in that tree.
Okay. Have you had any significant illness that affects your brain, such as a brain tumor, meningitis, West Nile virus, stroke or seizure, heart attack, near drowning, or near suffocation?
Mm-hmm.
What is your highest grade of school that has been completed?
3 years of college.
Okay. Do you have a learning disability?
No.
Did you ever have tutoring in math or English?
Yes.
Have you ever been diagnosed with fetal alcohol effects or fetal alcohol syndrome?
That's a woman in here.
Um, so as far as your tutoring in math or English, has that been in college,
Yeah.
high school? Okay. Has being tutored in math or English, how has it affected your use or being affected by your use?
My alcohol use?
Mm-hmm.
Well, I pretty much had stopped drinking by then.
Mm-hmm.
I guess I didn't say that right. Because I messed up.
Okay, let me just say it. I mean, instead of him saying that, you could have been like, it didn't affect it. Or it
What I did, everything I was doing was in my past.
Mm-hmm.
I just went to my present with the
Yeah.
college thing. So
I mean, but you can still say
alcohol
that.
wasn't there, you know.
Yeah,
I
you can
done quit.
still.
Yeah, okay.
If you want to say that, you can, it doesn't matter.
Okay.
So what it do? It didn't affect it, or it did? Or
Yeah, it did, you know.
did it affect your ability to grasp the?
Right. You have to concentrate. You have to remember. Good afternoon, Mr. Elom. My name is Melvin. I'm an executive director here at the Old Savannah City Mission. Your case was referred to me, so can you just tell me exactly why you're here today?
Basically, my mom and some of my friends and cousins think that I have an issue with weed and drinking alcohol, and I don't think I have an issue.
Okay. So, just gonna ask you a few questions, and we can, just move along and see where you are today. What is your ethnicity?
African American.
Okay. What is your marital status?
Right now, I'm with my boyfriend.
Okay. What is your emergency contact? Who is your emergency contact?
Shedrion Elom, IRENEELOM.
Okay. What is your do you have a home phone number?
No.
You got a cell number?
Yes.
Can you give it?
404 433
433
9369.
9369.
So what's the purpose of all these questions?
Just get a little background information, little contact information, and just try to find out a little bit about you. That's all.
Okay.
And all this is confidential. Whatever is said here will stay here. Our agency is a stickler on confidentiality.
So you're not going to tell if I have.
I'm not going to release this information to anyone.
Okay, that's good.
Okay. Who is the person that's responsible for paying your bill?
I pay all my bills.
Okay. Gotcha. What is your home address?
51 Pinson Street, PINSON,
Okay. Savannah, Georgia?
Yes.
And what's that zip, if you don't mind?
31404.
Okay. So you said someone sent you down here saying that you needed help. So what is the drug? What are exactly, you are seeking help for today?
Like I said, I don't think I need help, but if I did need help, I'd probably be seeking help for maybe stress.
Stress?
Maybe a little bit of anxiety. And
anxiety?
Apparently I have a drug problem, and an alcohol problem.
Drug and alcohol.
So, I mean, I think I'm okay.
Okay. Do you have any legal problems, job problems, school problems, anything like that?
No, I'm doing really well in school. I work at Victoria's Secret. They make me want to pull my hair out, but other than that, I think I'm doing pretty well in life. I think I'm good.
Okay. So when did you take your first drink or use your first drug?
Probably when I was about 13. With my uncle, he got me hooked on it. Like, I just had a good time going out to parties with him, and smoking and drinking. Like, that's how we're connected.
That's how it started.
Mm-hmm.
Okay, and the next question is, who was referred to here? But you said it was your friends.
No, my family. They told me to come. I got tired of hearing it, so I was like, oh, I'm just gonna come.
Family thought you needed help.
Mm-hmm.
Okay. In the past year, what was your income? Has it increased or decreased?
It stayed pretty much the same. I've been working at Victoria's Secret for a couple of years.
Okay. All right. During the last month, how many days of work or school have you missed?
Probably missed one day of work because the day before I got totally wasted and I had a hangover and I was just like, I'm sick, I'm not coming in.
Okay. And so it was because of the alcohol and drugs.
Yeah.
But that's not bad, just one day. So what are your goals for therapy? And I heard you say you didn't need therapy, but
I don't feel like I need therapy, but my mom says that I need to go into some more AA programs. I've already done AA, so like they have worse problems than me. They were having liver issues, cirrhosis, and things like. I don't have any of that. I drink heavy, but like I have a high tolerance.
Okay.
And I smoke a lot, so I mean, I feel like I'm doing good.
Okay. All right. Who lives or stays with you?
My boyfriend.
Boyfriend. Okay. Do you stay with you part time or full time?
Stays with me full time.
All right. Are you currently married?
No.
Okay.
But we're thinking about marriage.
So you're in a relationship with a significant other?
Yes.
All right. Yes. Is this relationship good, fair, or poor?
Probably fair. We have our issues, here and there, arguing, yelling, but that's every relationship. Like, sometimes he may slap me, but I mean, you gotta get right. Everybody gotta get right.
So, what about with your friends? Would you say your current relationship with them is good, fair, or poor?
I think it's good. I mean, they support me, but like, I also think it's kind of fair because, I mean, they also kind of told me I need to do something, but they didn't never tell me you need to go into go to a social worker or anything. But they're just like, maybe you need to cut down or something.
So, when you're with your friends, is it for socializing, reading, y'all get together because y'all drink and drug together?
When I'm with my friends, most of them don't drink or smoke, but the ones that do, we're together. We go out and we go to parties and stuff. The other ones, we're just strictly school and hey, bye.
Okay. Do you receive emotional support from your family or your friends?
Yeah, I can say that. I do, yeah.
Okay. Is it enough? Is it enough?
Sometimes I think it's not enough, but for the most part, it may be. I don't know.
All right. Unsure. Let me just say unsure. So, do you have any other source of emotional support?
Besides my friends and my family and my boyfriend, I probably have to say maybe like my mentor.
And who's that?
My mentor is my actual community faith leader. Like,
Okay.
I do go to church when I'm not.
Pastor, deacon, or?
Pastor.
Okay. Is your overall childhood, how would you rate that? Is it good, fair, or poor?
It was a good childhood. It was a good childhood.
Okay.
Nothing major.
All right. As a child, was your relationship with your mother good, poor, or fair?
Growing up, I was really close to my mom, and then once I started hitting like 13, when I started using, like we started splitting apart because she was just always nagging me and yelling at me. And I didn't want to hear that.
Good for a while. Okay. What about with your father?
With my dad, I just never really spoke to him.
Do you wish you could have had a relationship with your father?
I do, because most of my friends, they live in two-parent homes. They have the father and the mother and this perfect family, but you know, it's whatever. Like, I don't need a dad in my life. It's not that important.
What about your relationship with your friends? Good, fair, or poor?
It's fair.
Okay. What about other family members, brothers, sisters?
I don't have any siblings.
Okay. No siblings. Significant friend or relative? Okay, so how would you rate your current relationship with your friends?
It's pretty fair.
Okay. What about with your, do you receive any emotional support from your family or friends?
Yeah, I do. Besides my family and friends and my boyfriend, probably my community faith leader, my pastor at my church.
Okay. Overall, would you say your childhood was good, fair, or poor?
I think it was good, nothing too major.
Okay. What about your relationship with your mother?
My mom, when I was growing up, we were really close, you know, and then, you know, once I started using it about 13, like, we just kind of, you know, split up. We just kind of went our separate ways because she was always nagging me.
Okay. What about your relationship with your father?
My father, I didn't really know him. I don't want to speak to him.
Okay, yeah. If you had a chance, would you like to know your father?
No, I think I'm okay the way I am.
Okay. Well, as a child, how was your relationship with your friends? Good, poor, or fair?
It was fair.
Okay. What about your relationship with your other family members when you were a child? Like your brothers and sisters?
I didn't have any siblings.
Okay. Any cousins, nieces, nephews?
My cousins, you know, it was good. It was good.
Okay. A significant friend or relative, has any significant friend or relative died recently in the last year or so?
My grandmother, she died around when I was 13.
Okay.
So maybe that's why I started drinking and smoking.
Oh, okay. Okay, you say you didn't have any children. You You're not a parent, so
But I will be.
yeah, you will be, and you have your own biological child. So tell me a little bit about your religious belief, your spiritual, culture, and ethnic considerations.
I'm a Baptist. Um, I believe in the Lord. I do go to church. Like I said, I'm African American, so
Okay.
I guess I do American things.
Okay.
So I mean,
I hear you.
you know.
Okay. So what about your education? Are you currently enrolled in any school, college, or technical school?
Yeah, I go to Savannah State.
Okay.
I'm a junior.
Excellent. Looking forward to graduating?
Yes, I'm so excited.
Okay. So are you going full-time or part-time?
Full time.
Okay. What was the highest grade you completed in school?
I'm a junior, so
All right.
that's the highest.
And was your school experience good, fair, or poor?
It was good. I mean, I've had my times here and there, but
Okay.
I think it was pretty good.
Okay. Do you want to go back to school or training?
Well, afterwards for masters, no,
Okay.
that's too much.
So listen to degrees. Do you have any degrees or licenses or special training?
Yes, I have a certification from West Georgia Technical College for cosmetology.
Oh, okay. Are you employed right now?
Yes, I work at Victoria's Secret. I've been there for like 2 years now.
Full or part-time?
Part-time. I can't do full-time. They're making you do too much.
Oh, okay. You say you work for Victoria's Secrets.
Mm-hmm.
So describe some of the work you do.
Oh my God, I do everything. Like, they be having me put in sensors and stuff. I be about to stick myself.
Okay.
Like, what if I had diabetes? Like, what would I do?
Oh, yeah.
And, like, I have to put all these clothes out on the floor, all these panties, like, for hours and hours. I'm just, oh my God, it gets on my nerves. My feet hurt. Everything just hurts all the time.
So how long have you worked for Victoria's Secret?
2 years. 2
years.
long years.
Okay, so what about your relationship with all the other coworkers you consider to be good, fair, or poor?
Most of them good, but one, she get on my nerves. She's always trying to be the boss, and it's just the visual coordinator.
Oh, okay. So what does that mean? She's just visual coordinator. She just really like you, but she try to.
No,
She's group leader or?
No, she's nothing. She's just a visual coordinator. She's the person who works on the floor set and just, oh, you shouldn't do that. You shouldn't do like.
Oh wow.
Look,
okay.
I know how to do my job.
Okay. Have you ever served in the military?
No.
Okay. Have you ever been arrested?
I came close one time when I was smoking weed in my friend's car with her, but we didn't get caught.
Okay. Are you currently on probation?
No.
Parole?
No.
Are you currently in a drug court? Are you currently in drug court?
No. I've never got caught for drugs. Like,
Okay.
I'm good.
So, what about, so you're not even currently in domestic violence in court?
No. I mean, like I said, my boyfriend, like, slapped me one time, but everybody gotta get it right. Like, it's not domestic violence.
So, are there any members of your family currently that use alcohol or other drugs?
My uncle, he smokes and drinks with me.
Oh, okay. Do members of your family have a history of using alcohol or drugs besides your uncle? Anybody else?
I know my mom told me one time my dad, he was so drunk, like he could drink anybody underneath the table.
Oh, okay. So, at any time in the last 30 days, have you felt that you should reduce or stop smoking cigarettes?
I don't smoke cigarettes.
Okay. What about marijuana?
I tried. a while ago when I was like in this little support group for drugs, and I did it and I didn't like it, so I was like, I like the feeling, so I'm not gonna do this again. I'm not gonna quit again.
So, do you feel like in the last 30 days that you should reduce or stop?
No, maybe
Okay.
maybe I should.
Okay.
No, I just think I should just probably stop drinking alcohol since you're talking about the fetal alcohol syndrome, just for the sake of my child.
What about smoking the marijuana?
Marijuana, no, I need.
So you don't feel like you need to stop smoking marijuana?
No,
Even though you're pregnant?
no, I don't.
Okay. Has drinking or taking drugs caused you any problems with school, work, or friends, spouse, police, or your health
No,
within the last year?
no, I don't think so. I mean, I'm focused. I concentrate. I do what I gotta do at school. I do what I gotta do at work.
Okay, no problems. Did alcohol or drugs cause problems for you at one point in your life,
Um,
but are not a problem now?
well, probably the arguments with my mom. She used to hate when I like smoked in the house and everything. So,
So is that a problem now?
I mean,
Before you left?
I left, so
Okay.
I feel like it's solved. Like, me and mom should be on one accord now.
Okay. Has anyone else expressed concern about your drinking or drug use? And you said that your family and friends told you this.
My friends, besides my mom,
Okay, your friends.
the friends that don't smoke and drink.
Okay. Does your personality change under the influence of alcohol or drugs?
I have this alter ego when I get high. Named Sarah.
What do you mean by that?
Like, when I smoke or I drink, like, I just go into this whole other world and I act like a different person. I'm more
Okay.
out there and open.
Okay. Have you ever blacked out when drinking?
Maybe once at a party.
Okay. When you woke up, did you find yourself in a strange place, or did everybody was gone, or?
No, I didn't realize I was still in the same place.
Okay. So, you say you use alcohol and only marijuana, right? You don't use no cocaine, crack, and meth?
No, none of that.
No hallucinogens, inhalants? You don't
Mm-mm.
sniff glue?
No,
Anything?
no.
Okay. No opiates like heroin? You never tried cocaine?
No.
Okay. Sedatives, barbiturates, down like over-the-counter prescription drugs?
The only other thing I've tried besides marijuana, and it was one time, and it was at this party, and it was some lean.
Some lean. What is that?
It's codeine, cough syrup,
Oh, codeine.
and alcohol mixed together.
Wow.
It was one time, and I don't think I would ever do that ever again.
You ever tried Darvocets, steroids, or
No.
cigarettes, cigars, chewing tobacco?
Mm-mm.
None of that? Good, very good. Are you taking any current medication right now?
Only thing I'm taking is my asthma medicine.
Okay. Asthma medicine. And how often do you take this?
Every day.
Every day. Okay, can you describe to me any significant diseases, surgeries, or injuries from your past or present?
I don't have any. All I have is asthma. That's it.
Alright. Do you have any known allergies, including medication allergies?
No.
So what is your primary doctor name?
Bill 9.
Bill 9. Can you spell 9?
NYE.
N-Y-E. And you know his phone number?
912-358-6693.
Okay. Psychiatrist?
I don't have a psychiatrist. I'm not crazy.
Okay. So, what about your appetite during the last month? Is it normal? Are you eating more than normal? Is it poor? You're
Well,
pregnant, you eat too now, so.
Yeah, when I smoke, I get the munchies.
Okay.
But, I mean, now I'm pregnant, it's that times 15.
Oh, okay.
Because this baby needs some food, too.
Have you had sleep problems in the past?
A couple of times had I felt like I had sleep apnea, but I don't have sleep apnea, so I don't know if that's what it was.
Yeah. Okay. Have you ever been times when you didn't need much sleep?
No.
Okay. Your usual sleep pattern is it normal? Do you have problems falling asleep?
No, it's normal.
Okay. Were you ever a victim of a violent crime?
No.
Okay. Were you ever raped?
No.
Were you ever, as a child, ever touched or fondled in a sexual way that made you feel uncomfortable?
No.
Were you ever made to touch somebody else that made you feel?
No, of course not.
Okay. Were you ever forced to have sex by your spouse or significant other?
No, he know not. I don't play that.
Okay.
He know not to do that.
Were you ever forced to have sex? Oh, okay, sexually. Has anyone stalked you, in other words, followed you or kept track of your activities, causing you to feel intimidated or concerned for your safety?
There was this one guy, his name was Jim Berry, and he was just so weird. Like,
Right.
He had a crush on me, and I was like, why are you always stalking me? He's always trying to look for me. I'm like, I don't know you like that.
Wow. Did he grow up with you, or
Yeah.
y'all went to school together and all that?
Mm-hmm.
Oh, okay. So do you see him anymore?
No, I don't really see him anymore.
Okay. Are you currently afraid of someone harming you in any way?
No.
Okay. So what do you say? What will help you in therapy? For instance, will support from your family, parents, children, or others help you?
If I had to go to therapy, which I'm not all for therapy. If I had to go to it, I'd probably say support from my family, definitely. Like the family that doesn't agree, support from my friends, my community, and my church. I mean, they already support me, but they don't really know that I do this.
So you just said your friends. What about your spouse? Do he support you?
He supports me.
I mean, your significant other?
Yeah, my boyfriend supports me every way possible.
Good. Okay, do you have a positive and supportive sponsor? I know you said earlier that you talk with your pastor.
Mm-hmm.
So would you consider him to be like a sponsor if you really need someone to talk to?
Yeah.
Okay.
I can talk to him about anything.
You trust him?
Mm-hmm.
And he'll hold his confidentiality?
Mm-hmm.
Okay, say you don't go to a psychiatrist. What about, do you trust any of your employers, your boss, anybody? Would you?
No, I don't tell them about my life. They don't need to know that.
How do you feel about treatment? You said you don't think you need it, okay?
I don't think I need it, but others keep nagging me that I need it, and they keep saying it's an issue. So I'm starting to feel like maybe that's what I need.
Okay. Are you able to recognize when you have problems?
Yeah.
Do you have good self-esteem? Do you feel good about yourself?
Yeah, I have pretty good self-esteem, pretty high.
Okay. All right, so do you have positive plans? Do you have any particular goals for your future? I know you want to graduate, say you're a junior in college. I'm sure you're looking forward to graduating and getting this nice job. So, are there any other particular plans?
Particular plans, like, I do want the job, the nice house, nice car, like fabulous education. But like, I just want to have my little family with my boyfriend, hopefully get married one day, and you know, be okay. But I mean, all you can do is hope. Like, you can't say that's what's gonna happen because you never know.
Okay, so do you have a good relationship with a higher power?
Yeah, I talk to God every day.
So you choose God as your higher power?
That is my higher power.
Okay. All right. Do you have good work skills and work experience?
Yes, resume built.
Okay. And you do have education. Okay. What do you want to derive from therapy if you do decide to go? You want to find out what these people are talking about, that saying you need.
Yeah, like I would like to know, why do they think that I'm over drinking? What is considered as over drinking? Because people over drink or overeat or like everybody indulges all the time. So I'm like,
that's good.
There's nothing too much and there's nothing too less. So what's the balance?
So would you say that you're looking to see what dangers it might bring to you and your baby?
Yeah.
Okay. Maybe prevention, you know, once you find out that, you know. Okay, what about, do you need improvement in your interpersonal skills or relationships?
No, I have pretty good interpersonal skills.
Okay, what about communication skills? Do you need any improvement in that?
No.
Okay. Do you have contact with supported people? Very good. Do you need any anger management skills?
No,
Do you have a problem with anger?
Not an angry person.
Okay. Do you have a personal safety plan?
No, what is that?
Well, just like at your house, do you have an alarm system? Do you have an alarm system on your car? You're a young woman, so like you said, a man was stalking you at one particular time. So did you take a court order out on him or anything?
Oh, that no, my boyfriend, he protects me. He has some weapons, you know.
All right. Boyfriend in charge. Okay. Okay. That's pretty much it. So Miss Elom, after interviewing with you, and I realize you're pregnant, and I hear what you're saying. My job is just to find out a little bit about you, and I see that you do drink and use marijuana, and it is illegal in the state of Georgia to use marijuana illegally, even though they have made it legal for medical reasons. And you got your baby to consider. And I would just like to suggest to you, you said you don't need treatment, that maybe you'll just sit in on a 12-step program or AA meeting or something like that to actually see or hear some of the stories that some people have, things that they have gone through since, everybody started out like yourself, maybe 1 or 2 drinks a week and binge on the weekend, but then eventually, they wind up being out of control. So if we can prevent, and others are concerned about you, and I'm not telling you to satisfy them, but you said it would be nice just to learn a little something about what alcohol could do to you and your baby, because you wouldn't want to harm your child, and marijuana could eventually harm its brain or whatever. I don't know for sure. I'm not a medical doctor, and I'm not here to tell you that. I'm not here to force you to go to treatment, but I will suggest, and I know for a fact that one of AA, once you enter into AA, they want you to make a meeting every 90 days, and what you do is you do the meeting instead of drinking, and maybe you can try that, because you seem to me a very smart, intelligent young lady. You don't probably need alcohol or drugs. I'm just saying that as a person. And so I would like to suggest that you would go down to Salvation Army. They have a meeting every Saturday, and just maybe just sit in it. You know, you don't have to say you're alcoholic or addict. You don't have to admit to anything, and just listen and get your own concepts and theories about, whether you might really be an alcoholic and an addict. I'm not suggesting that you are. So, if you don't mind, I would like to set up an appointment to follow up with you in about 30 days just to see where you are. If that's all right with you.
Yep.
It was so nice talking with you, and I'm looking forward to seeing you again.
Okay, nice meeting you too.
All right.
We've evolved from small to tall and shall not stall, been flying too